Good evening and welcome to the Policy Subcommittee of the Brockton School Committee for November 10th, 2020 at 6:15 p.m. Due to the ongoing COVID-19 pandemic and state of emergency on March 12th, 2020, Governor Baker issued an executive order temporarily suspending certain provisions of the open meeting law, GL Chapter 30A, Section 20, pursuant to the order. Public bodies are temporarily relieved from the open meeting law's requirements that meetings be held in public places, open and physically accessible to the public, so long as measures are taken to ensure public access to the body's deliberations through adequate alternative means. This meeting will be held and accessible to the public via Brockton Community Access, Brockton Public Schools website, www.bpsma.org, YouTube, and Comcast Channel 98. The public can access this meeting via this link, www.youtube.com/TheBrocktonChannels. All right. Before we get into the agenda, I will call the roll to establish a quorum. Mayor Sullivan.
Yes.
All right. And Vice Chair D'Agostino, I'm a yes. Ms. Asak.
Yes.
Mrs. Mendez.
Yes.
Mr. Minicello.
Yes.
Mr. Rodriguez.
Yes.
Mrs. Sullivan.
Yes.
And Mr. Sullivan.
Yes.
All right. We have a quorum. Our agenda for the evening would be a review of the current COVID-19 metrics. We'll continue our discussion and review on the automatic failure policies in some of our student handbooks, revisit the reopening plan, any other business that needs to come before the committee, and then we do have an item for executive session at the end of the meeting. So I know we have Dr. Herman with us this evening. I didn't know, Mayor, did you want to jump in with a COVID update before we start the agenda?
Sure, Mr. Vice Chairman, thank you. And I want to thank Dr. Herman. He's going to be explaining tonight. The state changed the classification guidelines last week. And so Rick is going to be giving an update on that. I will tell you that we're up to 306 deaths. We lost another individual. So we're at 306, over 5,600 total cases overall. And currently over 450 positive cases, meaning 450 plus residents in Brockton are dealing with positive cases. So the ongoing testing at Brockton High, what's important to note about that, last Tuesday they changed it. So it's the much easier nasal swab as opposed to when I went on Monday, the day before, they did the long Q-tip up to the brain. So I will let you know that it is ongoing there. It's ongoing in Massasoit. And again, urging everybody to please be safe. Thank you very much, Mr. Vice Chairman.
Thank you, Mayor. So I guess we'll turn it over to Dr. Herman for the update.
Thank you. Thanks for inviting me again. Yeah, I was asked to come today to explain the new state metrics. So let me share my screen and we'll move on. So you're all familiar with this map, hopefully, and have seen enough of it. So this is really the map that we're now talking about, which is a map of COVID in the United States. And it really is the fall surge that we had been talking about. Now it's the upper Midwest and Plain states that are seeing the worst of it. Here in Massachusetts, this is the CDC timeline. We're on day 247, starting back from early March when the first case was identified. And the CDC measures, don't forget, in terms of a 7-day rolling average, as opposed to the Commonwealth, which measures a 14-day rolling average. But in any case, the CDC feels that we're seeing about 22.9 cases per day per 100,000 population. Here in Massachusetts, the number of big blue blotches is getting bigger. The big blue blotches means that 350 per 10,000 people, which means that 3.5% of the population of that town has been infected. And Brockton, of course, is one of those. This is the top 10 in terms of number of overall cases. We're 6th on the list. This is the red, yellow, green number according to the new classification system by the state. Brockton is at 24.1 last Thursday. And you'll notice that some of the numbers, even though they're higher than 8 or higher than 10, are now in the yellow. And I'll explain that in just a sec, but it mainly has to do with the fact that their percent positives are under 4%. So if we look at the new state classification, this is something that we've got to become familiar with. So first of all, it's broken down based on the population of the jurisdiction. So if your population is greater than 50,000, such as the city of Brockton, we use this final column here, the third column, as opposed to the lower population towns. So you get, the colors remain the same. You can be either gray, green, yellow, or red. And to be in a gray, I think we were last there in February, means that we had less than 15 cases. And this is over a 14-day period. So this is, they measure this over a rolling 14-day period. And don't forget, this Thursday, 2 days from now, they'll be releasing the numbers that lead the 14-day period leading up to last Saturday. So if in that period there were fewer than 15 cases, meaning about a case a day, less than 1 case a day, you'd be in the gray. A green is if your number is now less than 10. It used to be 4, but now less than 10 average cases per day per 100,000 population. So you have to be less than 10 and have at least 15 cases. In the yellow is more than 10, greater than or equal to 10 cases per day per 100,000, or you have a positivity test rate of greater than or equal to 4%. So either a greater than 10 or a greater than 4% will get you yellow, one or the other. If you have both a greater than 10 cases per day per 100,000 and you have greater than 4% positive, then you're in the red. We'll come back and look at this again just because it's a little bit confusing now that they've changed horses midstream. So this is today's dashboard. As Mayor said, total number of cases, total number of deaths. It's getting to be like there's a lot of people in Brockton right now who have not yet been cleared by the Board of Health so 463 active cases who are still considered to be in quarantine or isolation, or in isolation, I should say, because they have the disease. 21 hospitalizations, including 3 in the ICU. And so on the right-hand side, we've changed the look of the dashboard a little bit to meet the new state metrics. So I'm going to try and keep up and do this on a daily basis and change the number based on a rolling 14-day average. I don't want to wait until Thursday to find out where we were last Saturday. I think we can look at the numbers through the state epidemiologic network and be a little bit more modern and up to date. So this, for example, is looking at the 14-day period between October 23rd and November 5th. And our current number is 24.6. Our positivity rate is 4.8. This is going to be difficult to get on a daily basis. And the reason it's going to be difficult to get on a daily basis is because the state does not release the numbers on a daily basis. I've been talking to the state epidemiologist about doing that so that individual towns will be able to calculate this number daily, but they haven't done that yet. So we're going to be using the same number probably for the week, unless there's some data from the raw data that they release that we can put together a more accurate number. This will be a reminder of what our designation is. So greater than 10 cases per day per 100,000, greater than 4%. we're at 4.8%. And just to kind of keep you, sort of keep us honest, the state average right now, released last Thursday, was 15.3 cases per day per 100,000. And today's release of their testing rate was 4.42%. Now that's a little bit, I'll sort of full disclosure on this. They released 3 different numbers that include testing without the higher education and then with the higher education. So what happens is there are so many colleges in Massachusetts, and there's so much testing that goes on a regular basis, either daily or a couple times a week or weekly, that there are really just thousands and thousands of cases that are routine screening cases, and it brings the testing rate down. But if you exclude higher education and just look at all the rest of the Commonwealth, their rate is 4.42% positive. So again, just as a refresher, the red level is greater than 10 plus 4%. The yellow level is greater than 10 or 4%, one or the other. And the green has got to be less than 10. So if we go back and look at our past history of where we've been, this was according to the old system where we had 4, 8, and or greater than 8 was going to put us in the red, and between 4 and 8 was going to put us in the yellow. That is what our history looked like. And in fact, I've included what our number is going to be this Thursday. My prediction is it'll be about the same in the 24 range, but it's hard to tell because it's 2 days away and we still have test results coming in that were performed last week. So that number may change, but it'll be about in that neck of the woods. So this is what the old numbers look like. If we now looked at this number based on the new system, this is what our numbers would have looked like. So we would have been in the red recently for the past 4 or 5 weeks based on the fact that our average cases per day is greater than 10 and our testing percentage was greater than 4. But you'll notice that, and I'll just scroll back, this was the old and this is the new. So the old had us in the red a few places, but the new had us in the green. So why is it in the green? It's in the green because our number is less than 10 and our testing rate was less than 4%. During that period, it was 3-point-something%. So in fact, what would have been classified here as 8.8 in the red under the new classification would have been called the green. It is what it is, and those are the new rules that we'll be abiding by. I think it will be difficult for the state to change the goalposts again, and we'll just accept the new ones and go forward from here. Just this is just a look back, just because I was presenting to school committee, so I wanted to take a look at the younger individuals. This is a 4-week look back. So just 4-week look back leading up to the previous Saturday. So this will be a little bit longer than the look back that's going to be coming out this Thursday. So a breakdown over the 2-week period. You can see that it's the 20-year-olds that are still kind of leading the way, but the 0 to 20, if you combine these two, is really a close second. And this is kind of doing that. So what I'm doing is on the left-hand side, we're looking at the 2-week look back from the state for their last 2 weeks and what their age group was in the 0 to 19 and the 20 to 29, pretty similar. And this is a Brockton look back over 4 weeks, and it's showing the breakdown by age group. I included the 0 to 10 and the 10 to 20 just because that's how the state looks at it as well. So again, the take-home message is cases across Brockton, across the Commonwealth, really across the country, are skewed toward a much younger age group now. And just wanted to add two new things that have changed since the last time I talked. And these are news items that I'm sure you're going to hear tons about. One is of the 130 or so vaccines worldwide, Pfizer announced their emergency use authorization for the first vaccine that's received emergency use authorization. Or at least a success, I'm sorry, not emergency use authorization, but success of greater than 90% efficiency. And if this holds true, then we'll know by the third week in November. And if this holds true, this vaccine, more likely than not, will be distributed by the end of the year in the millions of doses. But the thing that didn't get quite as much attention, which I'm far more excited about, is this bamlanivimab, which is a monoclonal antibody. It's not the monoclonal antibody that President Trump got. He got one made by the company Regeneron. But this is a different monoclonal antibody made by the Lilly company, which is specifically targeted against the coronavirus and really represents the first treatment that is specific against the virus, such that the amount of virus in your system falls off dramatically after 7 days. It's given as an IV infusion. It's meant for adults so far. It's a single infusion and it's meant to treat mild to moderate cases. The idea here is to treat people who are not horribly ill, to prevent them from getting hospitalized or going to the ICU and dying. And I think that this could be a significant weapon against coronavirus. So that's all I have, Mr. Chairman.
Great, thank you very much for that. Are there any questions from the members of the committee for the doctor? No? All right, I wanted to know, and I think a lot of people are wondering this, again, because I've heard from a few folks. So this change, and I know to the best, you can only answer to the best of your knowledge, but this change in the way that we're measuring things now all of a sudden, like they came out with the metric in what, July, and that's what we've been going by. And then now they change, they move the goalpost, if you will, to this new measurement. Why? What was there, some scientific evidence or something that was behind it that?
Well, I can only speculate because I wasn't involved in the decision-making process, but
Understood.
I think I've said, to this group before that, the old numbers of 4 and 8 and green, yellow, red, really are not based in kind of the literature or the science because it doesn't exist. This is new for everybody. We're all inventing the wheel as we're going along. So it's all consensus driven. So you get a bunch of experts around a table and they say, well, what should we do? My feeling, just based on, having been living this life of talking to epidemiologists and seeing what other towns are doing and kind of following the COVID news, my guess is that there was a concern that the bar was too low, that everybody was going to be in the red and we were just going to have one big red map, and that other states, other municipalities had higher thresholds, and that seemed to be reasonable to try and change the numbers and add higher thresholds based on what other states and other jurisdictions were doing. The decision-making specifically about whether to open schools is really complex, as you all know, because you're living it. And the decision-making, has got to take into effect more than just obviously the numbers that are there. It involves, the whole health and well-being of the students and their families and the city as a whole. And the The way to decide that, I think, is difficult. And so what the state is trying to do is try and make it easy. When I remember several months ago when I first got involved in this, and Mayor Sullivan said that he had participated in some program by Johns Hopkins meant for city leaders that looked at various metrics that states could be looking at. And here was the textbook. Here it was. Let's look at percentage positive. Let's look at the rate of COVID in your community. Let's look at various social economic factors like overcrowding in your or frontline workers, or all the various metrics that we look at. Let's look at how social media is responding. Let's have observations about compliance with mask wearing and distancing and other kind of restrictions that could have been put into place. And it was multiple metrics. And it seemed reasonable that you would look at all of those things, because they all no city and no two cities and towns are alike. You can't. It's tough to compare, Brockton to Avon. It's just it's apples and oranges. They have different communities and different issues that are going on. But that's what the state wanted to do, I believe, is to make it a little more simple for folks to make their decision regarding in-person, hybrid, remote. And so in the process of simplifying it, and, they probably went too far in the sense that, hey, the numbers got greater than 8 and everything went red. And I think, there is more data that shows that younger kids tolerate the disease better. Older kids tolerate the disease better, but are sort of better at spreading it. And there is mixed data about the spread in various school systems. I think it's pretty clear that school systems don't rampantly spread the disease throughout all the towns and cities that have opened up their school systems. But yet there is, there are reports of clusters, and you've seen it in your own, neighboring towns and in Brockton itself. When schools open, cases appear, and the school does not have the wherewithal, whatever the resources are, to deal with that. So my message is the same, which is when you open up the schools in whatever way you do it, there will be cases, there will be COVID. It's not going away, it's here. And the approach has got to be to have a plan in place to deal with it when it arises, so that you feel that you have adequate testing, adequate case investigation, adequate contact tracing, and a plan that you've tested and everyone feels comfortable that they know his or her role in the plan moving forward. Because, we've seen the data. We know that already, 100 high school age kids in the city have gotten COVID. So it's going to be there. It's really just a question of having the plan to deal with it. So I don't know I think I went a little bit farther than answering your question of why did they change the goalposts, but that's kind of my take on the new numbers.
All right, and I always appreciate how thorough you are and really try to give us an in-depth understanding to the best of your ability. So I appreciate that. Mrs. Sullivan, I believe you had a question as well.
Yes. I just wanted to thank you, Dr. Herman, for your complete reports every week. They're very good. I know there's a lot of people that are very fearful of the virus, and I had heard that to catch it, you really have to be face to face with someone for 15 minutes without masks on both people to even catch it. Because we know if we wear the masks, we, sanitize our hands, we social distance the 6 feet while we're eating, that works, because it is working in some of these schools. So I was just wondering your take on, because everybody feels like it's everywhere, the COVID. So how do we prevent ourselves from catching it? I know the masks do work. Just your take on it.
Yeah. So, I've said this before, but, the science around COVID has changed a little bit. In the early days, it was, droplets, sneezing and coughing and surfaces. Don't touch the doorknob and the keyboards and everything else. And I think, that's morphed a little bit. I think it's pretty clear that droplets are the vast majority of a spread. So talking, coughing, sneezing, singing, just expelling air is going to expel droplets of this virus and are contagious. Surfaces, far less so. Yes, the virus does live on surfaces, and you can find little bits of RNA, hours and days later. But whether that actually contributes significantly to tons of infections, I think is pretty clear that it's far less important than the droplets. But there's also a small amount that's also called aerosol. So it's kind of these micro droplets, which is just COVID hanging in the air that can be there kind of like a fog, like a mist hanging there. But that's far less than the actual droplets. So how do you get it? Stay away from droplets. All I can say is, two things. One is everybody has COVID. Just pretend like every human being that you come in contact with has COVID, because they might. 50% of the spread is from people who have zero symptoms. So anybody on the, on the Zoom call, who had no symptoms could still have COVID. And so treat everyone like they have COVID. So what's the way to prevent it? Keep your distance, wear a mask, avoid prolonged contact. The 6 feet and 15 minute, that's what the contact tracers will use to determine if you're a close contact. Can you get it if you're 7 feet? Sure. 10 feet? Sure. 12 feet? Of course. You could. It's not as likely than if you were close, but there's nothing magic about the 6 foot rule. The virus doesn't know 5 feet from 7 feet. I'm telling you. It depends on how much virus the infected person has, how much force they use to expel the virus out of their body. But wearing a mask definitely helps. It is the best method of prevention of spreading the virus. So your mission in life, everyone's mission, is to not get a call from a contact tracer and said, sorry, Ms. Sullivan, but you were in a close contact of another person who had coronavirus. You were within 6 feet for 15 minutes, and mask wearing doesn't matter. You can both have masks. If you're within 6 feet for 15 minutes, you're still going to be a close contact. The mask wearing, it enters into decision-making, of course, but just in terms of the likelihood of getting the disease. But if you're within 6 feet of someone else for 15 minutes, then you're going to be a close contact. So what's their mission? Don't be within someone for 15 minutes within 6 feet over a 24-hour period. So if somebody gets a little too close, you back away. If someone doesn't have a mask, I don't want to be in the same zip code as them. The idea is, in your daily life, try and make that part of your routine of never being within 6 feet of someone for more than 15 minutes, because then you're never going to get the call that says you are a close contact of someone. So I know it's hard to do, but that would be, that's the ultimate mission. And the reason it's spreading right now is because of everything: workplace, home, family spread, people that and we look at the contact tracing the collaborative community tracing collaborative, CTC, and they share with us where the cases are coming from in Brockton, and it's everywhere. It's household contact seems to be the bulk, so within families, but also workplace, clusters, parties, get-togethers, churches, everywhere. And so, we're all letting our guard down. I'll plead guilty myself. We're all letting our guard down, and it's just, just going to visit my mom, just going to visit the family members, just going to have the neighbors over. It's just going to be the 4 of us going out to dinner, sitting face to face with our masks off, with COVID going across the table. And so that's how it's spreading right now.
Okay, and also I find it interesting that the teenage group in the 20s are higher right now because, when you're that age, of course, you feel as though you're invincible and you don't really have to wear the mask. And, I'm more fearful because I'm older. So I wear my mask all the time. And, so I think that that's why the cases are higher there.
Agreed. I think that it's just the social behavior of. I have a 21-year-old, and as I said, he goes to a university where there's 30,000 students, and 2,600 of them got COVID.
Wow. Yep.
So
Well, thank you.
that's
Yeah.
That age group.
Right.
And that's anecdotally that's what we're hearing is that that older folks, and I'm in that category myself, are far more cautious and have changed their behaviors, in a great deal compared to younger folks.
Right. And I think people that, they go out with their friends, they're kind of tired of it, so they don't put on the mask. And then it ends up that they have it.
The big deal is the asymptomatic spread. I mean, that's the big deal, is that you can get COVID from someone who looks normal, sounds normal, has absolutely no symptoms, but they are spreading the virus. And that's what makes it far more dangerous than the flu, for example, where it's true, the flu, you can catch it from someone who hasn't developed symptoms yet, but it's not for 2 or 3 days like with COVID. It might just be in the 12 or 24 hours before you develop symptoms with the flu.
Thank you very much, Dr. Herman.
Okay, Ms. Azak.
Thank you, Dr. Herman. As always, you always provide us a lot of information to help us get through this pandemic. Quick question. So we're at 24.6. I would have projected our numbers would be higher as of this coming Thursday, given for those that probably, were in contact during Halloween, and then we had the election where a lot of people were out. You've been on point this whole time with your numbers. So I'm surprised that I figured we were going to jump to like 30, especially after the last week that we've had, where everybody and their uncle, I saw my social media, people that normally did not go out, people had costumes on, people were getting together, gathering at friends and family. So I projected our numbers were going to be much higher, getting closer towards the Thanksgiving holiday. So I'm just curious.
Well, one is I could be wrong. I have been a lot.
You've been good though so far. Very close. Very
that's
close.
possible. So, this is trying to predict a number that's going to be coming out 2 days from now regarding testing that isn't, test results that haven't even come back yet. I think it's too soon from Halloween. So Halloween, let's just say, 1,000 people went out to the same party on Halloween and got infected. They're not going to get symptoms until 5 days after Halloween. Okay, so it won't be until November 5th that they even get symptoms. So they'll get tested on the 6th. Their result will come back on the 8th. And this number that I'm predicting is positive tests, that were drawn up to the 7th for a 2-week period. So Halloween doesn't even enter into that so much right now. So let's wait another week and see what happens for that concern. But I must say, I agree with you. I thought the number was going to be a lot higher also. It almost looks like it's kind of plateauing a little bit, which is not what is happening in the rest of the country. So cautiously optimistic that it's plateauing, but this is just so impossible to predict. But but that's where it is right now. And the reason this number changes is because tomorrow when I look at it, some of the cases that were assigned to us are going to get taken off the books and assigned to another town. And some other towns are going to look and say, hey, this person doesn't belong to us. They live in Brockton, and then they're going to give them to us. So I might get a case tomorrow that gets assigned from, last October 14th, that kind of, it's a rolling number. It is really an amorphous, rolling, changing kind of spreadsheet that has to be updated every day. But that's just where the number looks like it's headed right now.
No, well, the other comment I had is I went and I waited, and then I went to the Massasoit location. I made sure it wasn't the brain poker test, because that, after the first time I had it in March, it was awful. So, but I was really surprised that, oh, it's awful, Mayor. So I was really surprised that I mean, the amount of people that were there, I was impressed that a lot of citizens are getting out and getting tested, which was actually good to see that a lot of people are getting out. They're getting tested on a regular basis. A lot of us that are I'm actually going to try to get tested on a regular basis, given what I do for a living. I'm constantly with the public, open houses at properties. It's only to keep families safe, and to make sure that I'm not asymptomatic, and to keep my family and friends safe. But just for one location, I was surprised at Massasoit. They said up to 600 people within, I think they're there from 2 to 7, which is pretty impressive. I mean, do we have numbers? Just curious to see, like, how many are they testing at Brockton High? How many are they testing at Massasoit on a daily basis? Which is pretty impressive, the amount of people that are getting out and getting tested.
Yeah, I don't have the breakdown here for all the numbers, but yeah, I mean, we're like 1,500 cases a week of testing, and so I agree with you. I get tested every week, and I think that especially if you are leaving the house and interacting with other live human beings, I think it's worthwhile getting tested on a regular basis. And I think it's really important that to remember that the high school site now is just a nasal swab. It is a simple test. It is take a Q-tip, rub the front of your nose, and you're done. Somebody will do it for you, but it's not painful. It is not the nasopharyngeal swab, which is the wire that goes through the back of your neck into your car seat.
We call that the brain poker,
the brain poker.
Brain
It is not the brain poker. This is just tickling the front of your nose. It really is not a big deal, not a big deal at all. And it's worthwhile, it's worthwhile doing, especially, if you've been in contact with the public and just want to know if you're positive. It gives you some peace of mind to know that you're negative.
No, definitely. And hopefully eventually we will be able to, because I do know a lot of the colleges, my niece is an RA, and on a weekly basis, they have to get tested. And hopefully we can, it seems like they're making the test a little more available, and hopefully we can get the instant test. I think it's like a 15-minute or half-hour, results. Hopefully we can get those maybe once we do get back to school.
Well, that'll be another discussion maybe for another day. Antigen testing, it's good because it's fast. It's bad because it's not accurate and it's not accepted by the state. I shouldn't say not accepted by the state, but any positive test should be followed up with a PCR test to confirm that, in fact, it's a true positive, just because there is a high percentage of false positive testing with the antigen testing. There are some antigen tests that are a little bit more accurate than others, and that might be worthwhile having a discussion about. But just to be wary about antigen testing, if you truly want to know if you've got COVID or not, get a PCR test, the molecular test, the kind that's done at Stop the Spread locations like Massasoit or the high school. I personally would not put my faith in antigen testing yet.
Okay. And one last comment. I know Mrs. Sullivan had brought up the comment about being in direct contact with someone. I mean, honestly, wherever we go, they're spraying down supermarket carriages. They're spraying everything down. I think, this virus, I remember the times that we were wiping down our groceries when we brought them in the house, our Amazon. So, some people are under the impression that it's still easy to pick up this virus. And I think as long as we're constantly testing ourselves and keeping ourselves and our family safe until we can get to a safe vaccine, if everyone could just, stay cautious and limit what we're doing, especially our families, our BPS families, so we can get our students back to school. if as long as people are all working together and believing that the virus is still out there, and we just have to be cautious. I think it's still easy to pick it up. That's just my opinion, but I think that's it. I've taken enough time for tonight, but thank you as always for the information.
Is there any other member of the committee that has a question for the doctor? Mayor Sullivan, please.
Mr. Vice Chairman, it wasn't a question. I just want to give the members of the school committee some information. So Dr. Herman and myself and Dr. Montesir from Board of Health, we participated in a city employee town hall yesterday. We're going to do it again on Thursday. It's a Q&A for city employees, but I wanted to just let everybody know we'll be doing that, working with Superintendent Thomas and with the Vice Chairman as well, to offer that for school employees. It really is a Q&A session. It's very helpful. It's defining medical stuff that I don't know, but Dr. Herman truly does know. And I also just want to let you know, today, Rick and myself participated in I had reached out to all the neighboring towns, from Abington to Avon to East Bridgewater, every town that touches Brockton, and also Randolph. And I asked for their town manager, town administrator, chair of the selectmen and Board of Health. And we did an hour Zoom today to share best practices, to see if we can learn what other towns or municipalities are doing. It was really, really good. And we'll be doing that on a monthly basis. And then lastly, Rick showed about some promising vaccine potential. And I wanted to let you know that every morning at 10:45, myself, Steve Hook, who's our director of Brockton Emergency Management, Dr. Herman, and Dr. Montesir, we have a call every day. And today we discussed how we would be planning to distribute the vaccine. We're not there yet, believe me. The vaccine hasn't been approved by the FDA, but we are right now starting our process on how we would do it. There's been a plan on the books for the city of Brockton for mass distribution of syringes and giving shots and vaccines. And it takes place at Brockton High, both inside and outside. So again, just wanted to let you know that we're already really working diligently on that. And it'll be a happy day when we can say that a vaccine is going to be given to Brockton residents, but we're not there yet. So Dr. Herman, as always, thank you for that information on behalf of the school committee. Thanks, Rick.
Okay, my pleasure. Thank you for inviting me. Okay for me to go?
You're all set. Thanks, Doc.
Okay, bye-bye now.
All right. If there's nothing else on the COVID-19 agenda item 1, is there anything else on agenda item 1 before I move on to item 2? All right. One housekeeping thing. I wanted to see if maybe we could try this, just because it'll be easier for me to see who wants to speak. We do all right with the hand raising, but does everybody see the participants button down at the bottom? And if you click on that, at the bottom of the box that pops up with everybody who's on the meeting, there is a little button to raise your hand. I don't know if we can try, experimenting with using that, because then that way I'll see it and I can make sure that I get to everybody. So let's give that a whirl as well. Okay. So next on the agenda is our automatic failure policy discussion. I assume everybody did receive the handbooks so that we have them all, and to review and look at in the context of this matter. Superintendent Thomas, did you want to kind of run with that?
Yes, thank you, Mr. Vice Chairman. So I just put in last Friday's packet the information, actually the Friday before, the information about automatic failure. So that does exist at Brockton High School, at the FDA Key Center, Champion High School. It's if you are absent a certain amount of classes and you do not have a doctor's note, it turns into an automatic failure. If you were passing, you had anything 60 or over and you were passing, then you would then fail and get a 59 if you did not have excused absences. At the elementary and middle school level, it's more of, it doesn't put a number on failures. For absences, it just basically says that if there's excessive absences, the principal, assistant principal, teacher, guidance counselors, adjustment counselors will work with the family to try to obviously engage the student in school and get them back to school. At the high school, they have that same language in there, but it does put a hard number. If you were absent this many times, then you get an automatic failure. So a couple weeks ago, I asked if, especially for the first term, if we could relax that policy that's in place. And then basically the teachers are working with the students. And if a student would not be able to automatically fail, however, the student still needs to be able to have a passing grade. So this relaxing the automatic failure policy does not excuse the student from doing the work they need to do to produce passing grades. It just doesn't automatically fail them if they're absent. It's basically giving the student the grade that they earned without the possibility of automatically failing.
Okay. Superintendent, I was looking at, I think there is also a similar policy, or maybe I'm misunderstanding it, in the middle school handbook on page 19. Students automatically fail all subjects upon the 6th absence in a marking term. If the student would have passed, he received, yeah, so it's a similar policy. I guess we'll have enough. Is that? And admittedly, I didn't get to look in the Huntington book yet.
For the middle school, Mr. DiAugustino?
Yeah, page 19.
Yeah, I have it.
And it's, under
Yep.
the school attendance policy. So I think it's there too. So if we're going to address it for the high school level, I would assume we'd want to address
You're right.
it
It's 6 absences in a marking term. Correct.
Yeah, it's a little more
The
forgiving.
elementary, it was the elementary only that doesn't have a number on it.
Right, exactly. And is there something, and I'm trying to see if there's anything in the Huntington manual as well. And I don't see it. Daily attendance requirements. It doesn't look like.
Yeah,
there's
the
any-
Huntington, because of, obviously it's a therapeutic day school.
Yeah, it doesn't look
So-
like it's in there.
Yeah.
Okay. All right. I just wanted to continuous. Yeah. All right. Similar to the elementary in that one, it talks about outreach to families and that kind of thing. All right. So it's really all of the high school level and the middle school that we need to address on this matter, correct?
Yes.
Okay. All right.
And it's also, I think, something that now that obviously we're talking about it is something that, we should review going forward, especially when we get to the spring to review our handbooks. Whether this is something that we need to keep in.
Yeah. I mean, we can certainly have a lengthy discussion about that. So anybody on the committee want to weigh in on this? No? Okay. I know that we had, I think we'd already made a favorable recommendation to the full committee to suspend the automatic attendance provision for the high school. Would I be correct in assuming we should make another recommendation to include the other schools?
Yeah, middle school and all, in all the other schools that have that policy which would be the Frederick Douglass Academy and the Key Center. Dr. Cobbs, I'll let you, the Edison.
Yes, we have a similar policy. If they miss so many days, it's an automatic failure, which, we the same thing. We want to suspend that for now and give the students a grade that they earn.
All right. So,
Thank you, Jim.
all right. So middle, we don't need it for Huntington. We already took care of the high school, but we need to deal with Frederick Douglass, Champion, and Edson. Douglass, Champion, Edson. All right, so I want to make sure I have this right. So we basically need someone to make a motion to suspend the automatic, to recommend to the full committee that we suspend the automatic failure policy due to attendance for the middle, middle schools, Frederick Douglass Academy, Champion High School, and Edson Academy. Did I get everything there? I think so. All right. Do we have anybody that wants to make the motion on that?
I'll make the motion, Mr. Vice Chair.
Thank you. Thank you. We need somebody other than me to do it. All right. So we have a motion to suspend the automatic failure policy due to absence at the middle school, Frederick Douglass Academy, Champion High School, and Edson Academy. And do we have a second?
Second.
All right, we have a motion on the floor by Mayor Sullivan, properly seconded by Mrs. Sullivan. Is there any discussion on the motion? Okay, seeing no discussion on the motion, I'm going to call the roll. Mayor Sullivan.
Yes.
All right, I will vote yes. Ms. Asak,
Yes.
Mrs. Mendez,
Yes.
Mr. Minicello,
Yes.
Mr. Rodriguez,
Yes.
Mrs. Sullivan,
Yes.
Mr. Sullivan.
Yes.
Okay. Motion carries unanimous for a favorable recommendation back to the full committee. All right, anything else on agenda item number 2 before I move on? All right, I don't see any hands waving and I don't see anything in the participant list. So I'm going to assume we're good to go and move on to the reopening plan. Again, Superintendent Thomas, if you want to frame this issue.
Sure. And I'll share my screen in a minute with the updates regarding the new metrics from the Department of Education, the guidance that they sent out on Friday about what districts should be doing and what, obviously what color they fall in for the metrics. But first, I just wanted to bring the attention to the committee that we had a reopening date of November 19th when we first took the vote to go fully remote back in August. So I wanted to, obviously, we would not be ready to open on November 19th. So I wanted the committee to discuss that date and talk about a future date. And we might want to do that after I share the screen for and go over just what the Department of Education has sent out. But obviously we can discuss before I can share my screen and go over that first.
Anyone want to weigh in on the upcoming end of the term, or do we want to see the presentation from the superintendent first? Well, I think it might make more sense if we see your presentation.
All right, I'm trying. Wish me
Oh,
luck here.
Are we supposed to kill a little time? Is that
No,
what we're doing?
I'm good. Can you see it?
Yes.
Are you good? Okay.
Yep.
So basically, after the governor's press conference that had the Secretary of Education and the Commissioner of Education with him, talking about the new guidelines that went in place with changes to the curfew that went in place, changing meeting size outside and inside of gatherings. So at that same press conference, they released the new metrics and talked a lot about schools. So I'm going to just bring you through, and this basically the beginning of this talks about that schools have not been proven to be spreaders of COVID. So I'll just bring you to the guidance that has been sent out. It was sent out Friday. So I'll bring you to the bullets. So districts are expected to prioritize in-person learning across all color-coded categories unless there is a suspected in-school transmission in accordance with DESE's guidance on responding to COVID-19 scenarios. So again, they're saying that, pretty much all color-coded districts should prioritize being in school unless you see that there's a spread or there's several cases in a school. The next bullet is districts and schools and communities designated as gray, green, or yellow are expected to have students learning fully in person if feasible. And a hybrid model should only be used if there's no other way to meet the health and safety requirements. Schools in red communities should implement hybrid models while maximizing in-person learning time for high need students. And then in those communities with the highest COVID-19 caseloads and test positivity rates, currently Chelsea, Lawrence, and Revere, there is some question whether we fall into that the Department of Education and DPH would work with the local school officials to develop and implement strategies to reduce in-school health risks. And then fully remote instructional models should only be implemented as a last resort in classrooms and schools when there's suspected of in-school transmission. And then finally, as a reminder, structured learning time requirements for students and in the standards that remain in effect for all school districts. So basically, whether you're remote, hybrid, obviously or fully in person, that the time on learning guidelines need to be followed. So again, I needed to make sure I shared this with you because it is guidance that came out from the Department of Education. There has been some pushback from superintendents and also from the Mass Association of School Superintendents, because again, there are collective bargaining agreements in place that local districts worked hard with their unions around a return to school, a safe return to school, and the models that are used, as we did here in Brockton. But again, I'd be remiss if I didn't share the current guidance from the Department of Education. And it was stated in that press conference that the communities that are fully remote, that, you know, I'm sure that they will be contacted by the Department of Education to figure out what our plan is going forward. So I just, again, wanted to bring that to the committee's attention. Again, I still obviously think it's all about health and safety of our students and staff. Again, we have, you know, plans in place, and we've worked with those plans with all our unions to have collective bargaining agreements in place. And again, as you just heard from Dr. Herman, so I think I just wanted to make everybody aware of the current guidance from the Department of Education as we start our discussion about revisiting our reopening plan.
All right. All right. So comment, question from the committee? Anybody have any thoughts on potential reopening? Mike, oh, go ahead, Mayor.
Yeah, I mean, I think, I think just based upon the metrics and the data, I just don't think at this time, we can. I mean, we had taken a lawful vote. It expires next week, November 19th, first term will be over. I think we should make some type of recommendation back to the full school committee tonight so that we can take a vote next week and meet the deadline of the 19th. Now, if we look at when the kids and students are supposed to go back, if we were 100% back or a hybrid, Mr. Superintendent, wouldn't it be January 4th after the holidays? Would that be the date, Mike?
Yeah, that's the date after. That's the Monday after, because the 3rd is a Sunday, correct? I believe, correct?
Okay, yes.
Yeah.
And then 2 weeks after that would be the Martin Luther King holiday. So I think, in my humble opinion, again, we had taken a vote. We had also done the right thing to make sure that we're going to give 2 weeks notice to family members, guardians, parents, loved ones to be able to plan, right? So whatever that is, whatever we decide as a committee, but I would think tonight we definitely need to take some type of formal vote favorable back to the full school committee to render the vote next week. But I can't imagine in good faith, I mean, November with the holidays coming up, that we can even consider that. But again, I'll listen to my fellow members of the school committee. Thank you.
Thank you, Mayor. Mrs. Sullivan? Oh, you're muted.
Sorry.
There she is. Go ahead. No problem. Go ahead.
I agree with Mayor Sullivan to kind of wait till after the holidays because that's usually when sicknesses spike everywhere.
Mhm.
So I would be a little apprehensive before the holidays. It's just my feeling. I know there's a lot of parents that, really want their kids back. But with the holidays, I feel as though it's going to go higher. Thank you.
Okay. All right, thank you, Mrs. Sullivan. Anyone else, any other member of the committee want to weigh in? Mrs. Mendez.
Hi, so I was just reading the survey comments that we got. I think it was like a week, 2 weeks ago. And a lot of what I hear that parents are commenting, they're frustrated and children are frustrated with the long schedule. I know that state regulated that when remote, they said that when we're gonna do remote, it's gonna have to be that long schedule of remote. If we decide not to go back to school, November 18th, if we vote, is there somehow we can come back and start talking about kind of the concerns that parents are talking about, more social interactions, more movement breaks, maybe reconsider. I know we've reconsidered the schedule for kindergarteners, and we're trying to reconsider different schedules for high needs learners as well, but it sounds like this is across the district thing from the parent survey, and it's a huge frustration. So honestly, I thought it would be, I know it's not ideal, but I had to wonder. I know we looked at the metrics, but looking at what Desi's saying, even if we're red, even if we're on the red, do we think it would be not wise, but would we be open to the idea of starting to phase high learners in before the holidays? I know I've heard a lot of people say after the holidays to see how it goes, but is that something that we're open to the idea of doing, just to put it out there?
Yeah, I mean, I think we had Laurie Mason came to our last meeting to talk about that, and correct me if I'm wrong, but she didn't seem too comfortable with that at this point in time. Mike, is that correct?
Yeah, again, it was about a lot of parents were expressing the concern about, health and safety. But it's also something, Ms. Mendez makes a good point. I mean, we have to, I think you can take a vote on a date, but I think we have to put in that we have to continue to look at, because that is our mandate to do our best we can and to bring students with disabilities in. And also, even when we do have the okay, when it's voted to come back to school, I think you have to phase in, because I think it's important. Obviously, we have to get our special needs students back, but I think we would phase in our youngest students first as well, pre-K to probably grade 2, because again, as you saw, the numbers that, they are less to spread the disease, the COVID. So I think we would look at those 2 groups of students, our youngest learners, our special needs students, and then obviously would look at phasing in the higher grades as we go. And it's just, the other point I wanted to make is in teachers have been working, trying to find times to get the students more away from the computer. We do have to be careful because Desi we had to fill out a survey for them because they are getting several complaints, the Board of Education, of schools not doing that, schools giving too much asynchronous time, too many movement breaks. So we had so they were getting a lot of complaints. So they sent out, they only gave us 2 days to do it last week, a survey of what our model is and how much time students are in class. So, again, it is important to get students away from the computer. I'm 100% in agreement with that, but we do have to be careful that we are mandated to teach a full day. And they do count all of those minutes. So, and they are looking at districts who are using too much asynchronous learning or have too many movement breaks built in. What they're going to do with that information, I don't know, but they are looking at that. But I agree with Mrs. Mendez that we really do, kids do need to get away from the computer as much as possible. And, and I know teachers are working hard to give them those breaks and give them some time to work on their own and complete homework and to have time to work on assignments. So, and we'll continue to do that. But it would be good to come back, as Mrs. Mendez said, we can have we can do a report on that and talk about the structure of a day for each level.
Because I had some other wonders just from these comments that I'm reading from parents. So a lot of comments that they had was about the gym, just because they feel like, you know, gym is not the same, obviously. A lot of them are probably watching, according to this video. And so they were wondering if that instead could be more of a social emotional activity. So that's still minutes, right? And then instead of asynchronous, where I guess Mondays, a lot of parents are liking that Monday schedule where we have but I know state regulated, we can't do that all the time. But instead of doing asynchronous, have we ever thought of like maybe office hours with teachers? Because that still can count as minutes, where now they have smaller groups, and then, you know, maybe we can talk about it further, but I'm just
Absolutely
out there because I know, like, just throwing out there. And then I was gonna say one more thing about yeah. Oh, I was gonna say, sorry. Sorry, I had a brain fart for a little bit. I was just wondering, so I know Superintendent Thomas, you do a lot, you're part of the urban superintendent meetings. So
this Friday.
Yes, so you hear what they're doing. Have we ever looked into what the suburbs are doing? Because I wonder how much movement breaks are there? What does a full schedule look like for them? And that way we can have a few comparisons of different schedules that are not just urban and looks like Brockton, but maybe pull from other sources as well.
Absolutely. The district design team is in the process. We meet again Thursday of looking at our reopening plan. The reopening committee came up with for the hybrid model. We're working on looking at that and possibly tweaking it from obviously best practices across the state. We will be looking at other school districts, suburban and urban districts, how it's going with the hybrid model. June, Ethan talked to colleagues, assistant superintendents across the state. They'll be doing that. Kim Gibson meets often with other union presidents, and she's going to be gathering information from what they're doing in cities and towns. So we have a better idea of what their hybrid model looks like and what's working well and what's not working well.
Because I think that would be good when we're talking about this, to bring it to the table as well.
And I'll have the discussion that Friday. We meet Friday for 2.5 hours with the urban superintendent. So I'll have that discussion as well.
Okay, great.
And, you know, I had a thought too, to Mrs. Mendez's point. I think if I heard you right, you had said that there was comment about just having students having interaction with each other. I don't know if maybe that's the starting place where we can come up with some kind of a structure that we're comfortable, that we feel is safe, where there is some type of an option for that, for the kids to have some limited interactions, to get that social interaction without formally, like, maybe that's where we start. We try something like that. And I'm not saying that we would take a vote on that tonight. I think that'd be premature, but maybe that can be explored. We can kind of see some options on that and try something organized that we can control the safety and all of that, to kind of start, it's kind of the starting point of maybe eventually leading towards grade by grade, bringing some kids back. But I agree with the mayor that right now is premature. We see other districts that have been shifting in the direction we went with remote. So I don't think that it makes sense. Well, everybody else is going the way we're going to, turn around and change course right yet, so is there any other comment on this before I ask for a motion on anything? Mr. Sullivan, please. Can't hear you.
Muted.
Yeah. Can I unmute him? Oh, there he is.
There it is.
Okay.
Sorry. Mike, our goal is to get the kids back in school. I'm sure every one of the school committee is getting phone calls every day to do that. What I was wondering is there a plan in place for, I'm just gonna call it a retreat. So in other words, we retreat back to hybrid. We bring the kids back into school and we can retreat if something goes wrong, the numbers go up. We go back into the red. You know what I mean?
Yeah, you have to be able to, built into the plans, you have to be able to switch from one model to the next. So the hard work with the fully remote has been done, obviously. All students have a laptop. Again, we still want parents to reach out if they need a MiFi device. We still have several of those in stock if people are having issues with internet access. So, you know, I just want to remind parents of that. If you do need internet access, or if you're having a lot of issues with your current internet access at home, we encourage you to call the school and request a MiFi device. But we would be able to switch back into remote learning pretty, right away. I mean, if there was an issue and there was a spread on Thursday and everybody had to go remote for Friday, then everybody would just be able to be remote Friday without us having any lead time, without any transition time. That would be automatic. You do need at least 2 to 3 weeks to transition to hybrid from remote, just because the first time, obviously, because you have to set up bus routes and make sure all students can fit, and there's still some work to do around that, because our schools are large. A lot of our schools are large, so like Brockton High, a typical hybrid model where half the kids on 2 days a week and half the kids the other 2 days a week, that's still 2,100 kids in the building. So we might have to look at a different model for Brockton High, where it's broken up into a third of the students, so to allow for more social distancing and less traffic in the hallways. And I think even if you break up Brockton High in half, it's still it would probably be the second largest high school in the state. So we have to look at that to make sure, because I don't think a typical half and half model would work at the high school. That would have to be a change. We're working on that now. And you have schools that are large, like the Davis School has over 1,000. The George and the Baker are close to 1,000. So you really have to look at how those schools would be brought back safely. But we would be able to switch to, once we're in a hybrid model, you would be able to switch back to a remote model without a problem.
Mike, what about the buses? I mean, how much lead time would they need to go back to
3
not
weeks.
being used at all? They need 3 weeks?
Yeah, because most of their drivers have been sent to other parts of the state to drive for first student. First student holds several contracts. A lot of them local, a lot of them not too far from here, within an hour and a half. So a lot of their drivers have been sent to other locations to drive, so they would need time. Obviously, call them back to Brockton, get the buses ready. We would have to obviously, and we've done that work already, is refine the routes, because obviously you're going from having 55 on a bus to 23. So, we would need about 3 weeks to put that plan in place.
Okay.
Thank you. Mrs. Sullivan, you've been patiently waiting.
Yes, I just like to say that the social emotional that you talk about, Vice Chair, that's already going on in the community where children are, together. When school isn't in session, places will think up ways to have the kids there. I know there's a karate studio that has kids there because parents have to work, so, and I'm not saying the school should open because parents have to work, but kids, there's a lot of kids that are really having a hard time with this. And as soon as we can get, the high needs students back and the early, like Superintendent Thomas said, the better. It is working in other school districts. the schools, I am working in a public school district right now, and they're very good. You know, people are not allowed in. The nurses are working very hard, and you know, everybody is checked. And it's just really important that kids get back to some sort of normalcy. I mean, I watch the kids out at recess and stuff, and you know, they're missing being with their friends, and it's a big part of their life. So that is already going on. I mean, there's baseball going on, sports going on everywhere, high schools and private sports. Kids are already getting together. You can't keep them in the house away from their peers. It's very troubling to me that they can't see their peers. Yep. So thank you.
No problem. I think, you know, what you're saying is obviously true. There are some kids that are getting together, and, you know, unfortunately some aren't. And like I said, you know, maybe we can start to create some situations that to open up even more opportunities. But you know, again, we've talked about this, that we need to focus on the higher need kids, higher need learners first, to getting them, you know, back in school as soon as it's possible and safe. And Judy, can I ask, the district you work in, are you hybrid or are you full in person?
It is hybrid.
Okay. All right. I was just curious. Thank you. Did I see a hand from Mrs. Mendez?
Yeah, I just wanted to respond to what Ms. Sullivan was saying. I mean, it sounds like you're talking about maybe a small percentage of kids. And when you talk about social interactions like karate and private baseball, and, you know, we got to remember that's a very small percentage of our children that come to Brockton High. So we can't overlook the ones that are actually not getting the social interaction or the social emotional wellness that we can, you know, provide those structures for. But I do agree with you where, you know, we should prioritize our high learners to get in once it's safe. But I just think, like, you know, there's a lot of families that can't afford those private like sports or karates, and their kids are losing out of that and aren't able to partake in that. So just something to look at.
And I think to both points, this is why I was saying maybe we can start to look at some kind of way that we can put some opportunities together, but we can make sure that it's done in a safe way. You know, when you mentioned karate schools, like, you know, my son and I do take karate lessons, and it's marked out 6 feet apart. You have a box on the floor, and that is your space, and you've got to stay in that space. Masks worn the whole time. You know, and I guess that was my point, is could we look at a structured way to provide something? Again, I don't think that that's the vote for tonight. I think that's something that we can look at and explore and kind of have a deeper discussion on, a deeper dive on in another meeting. Just my 2 cents. Any other thoughts? Anybody else want to weigh in? Okay. If not, it sounds like we need a recommendation to the full committee to either continue remote learning until at least January 4th, or a recommendation to go hybrid, but we need some sort of recommendation to the full committee. Does anybody want to make a motion on that recommendation?
Mr. Vice Chairman, what day would Brockton Public Schools go into winter break before the holiday? Does anybody know what day in December that would happen?
The 23rd.
23rd, Mr. Superintendent? I mean, I think it would probably be helpful. Again, November 19th, why don't we contemplate making a recommendation to stay remote until December 19th. We'll push it for 4 weeks, and then we can reevaluate it with Dr. Herman during that time. Realistically, though, I would suspect we're going to get into January. So I don't know if it would be helpful to say, you know, to Brockton Public School educators and parents and guardians and loved ones, you know, we're still going to vet it out. November 19th is next week. We're going to punt it again for 4 weeks to kind of look at it. I don't know. I just throw that out there. Or the alternative would be to go after the holiday season when schools would regularly open again on January 4th. It's just my thoughts.
Yeah, well, I think if we go right up to the beginning of the holiday, that covers us until then, and then obviously we'll revisit it at that point, and if that gives us the holiday break time to, well, we'll be on holiday break, but to start preparations and kind of vet it. So just to make sure we've got the calendar right.
So the last day of classes before the break is December 23rd.
Okay, so we would want to go, whatever we're going to recommend to do, we would want to stay in that mode till December 23rd, and then we can revisit it. And like the mayor said, push it out 4 weeks and continue these discussions. Maybe in the motion, we can, again, like we did before, agree that we will continue every 2 weeks to have a policy subcommittee meeting to have ongoing discussions about these things. There was some great points that Mrs. Mendez brought up, and the superintendent and Mrs. Sullivan, a lot of good ideas and points that we can continue to have ongoing discussions about. All right, so I think we need a recommendation to the full school committee to stay in some sort of learning mode, whether it's remote, which it seems to be the direction we're going, until December 23rd, with an agreement to continue every 2 weeks to review and discuss where we are. Does that sound right? And does anybody want to make such a motion? Anybody?
Mr. Vice Chairman, just point of information, when would our, because I'm new to the school committee, when would we have a school committee prior to the 23rd?
Melinda has the date, I believe.
Yeah, do we have this? I would assume the 8th or the 15th.
We have December 15th,
Okay.
and then we have January 5th.
All right. So actually, we're meeting right before that. So that timing probably makes good sense because we're right there.
Thank you, Melinda. Thank you, Mr. Vice Chairman.
Sure. All right. Anybody?
I'll make the motion, Mr. D'Agostino.
Thank you, Ms.
But I
Azak.
apologize. I have intermittent service right now. So a motion to, how about I just, whatever you said. We'll go with that.
Tell you what, let's do it this
It
way.
was a long one.
You can just
And I
say,
apologize, but no one else
Right.
is speaking up, and my service is very choppy this evening.
okay, let's do this. We need a motion to remain in remote learning until December 23rd, and the school committee will also continue to meet every 2 weeks in policy subcommittee to continue to monitor and review our remote learning. Do we have anybody that wants to give me a so moved?
I would
So
say it would
moved.
be, yeah, I would put in to evaluate our learning model.
To evaluate our learning model. Thank you. I was searching for the words there. Thank you. Perfect. Okay. So motion to recommend to the full committee that we remain in remote learning until December 23rd. And the school committee will continue to have a policy subcommittee every 2 weeks to evaluate our learning model. Can I get a so moved on that?
So moved.
Do I have a second?
Second.
I was gonna say,
Second.
for the love of God, somebody.
Judy just second.
All right. We have a motion by Miss Asak, properly seconded by Mrs. Sullivan. I will call the roll. Mayor Sullivan.
Yes.
Thank God. D'Agostino is a yes. Ms. Asak.
Yes.
Mrs. Mendez.
Yes.
Mr. Minicello.
Yes.
Mr. Rodriguez.
Yes.
Mrs. Sullivan.
Yes.
Mr. Sullivan.
Yes.
Okay, that is done. Reopening plans done. All right, I think we're in good shape. We have, to my knowledge, we're at other business, and there is one item of I'm sorry, Mrs. Mendez.
For other business,
We lost
other
you.
business, I want to propose November 24th to propose a meeting for 6 p.m. for the Diversity, Race, Inclusion, and Equity Subcommittee to meet
November 24th at what time?
at 6 p.m.
6 p.m. Okay, and I think you can work with Melinda to get that scheduled, and that'll get on the calendar accordingly. All right. And then Ms. Asak, you had reached out with me about an issue regarding Connect Ed calls for other business. Did you want to speak on that?
Yes, I actually spoke with Jess Hodges before she went out on maternity, and we've been getting a lot of complaints from families that within the past month they receive the Connect Ed calls, but if they go right to voicemail, they're getting a 5-second blank message. So something has happened within the past, I want to say towards the end of September, maybe October, where before, and I know for myself, I would let it go to voicemail so I can go back and listen to it at a later time, especially if I was working or driving. So I know Jess was looking into that because a lot of parents have been having issues. If we can see what's going on, it's been a month.
But we
And
actually
I know-
have looked into it, and it looks like soon we'll be changing the company we're using. We use School Messenger. Jess, along with Ethan, Kevin DuPont, have worked on with other companies, and we are looking at changing over. And it would be an easy changeover because it would go right to all the numbers would transfer. But there are issues with School Messenger. There are issues across the country with School Messenger, and they're not clearing the issues up very well. So about 3 weeks ago, we started looking at other companies and companies that we could switch over, have a flawless changeover to. So we're in the process of working on that now, and hopefully within the next 2 weeks, we will see a change made.
Okay,
Because
yeah, no, definitely.
it doesn't seem that the text messaging system is okay, but it does not seem that they can fix their issue with the voicemail.
Yeah, no, it's something that's new because everything was working fine up until recently. And I know people are missing messages, especially if they need to pick things up at schools the next day, getting last minute calls and stuff. So that was one thing that a lot of the families have reached out. And I experienced it myself because my messages were blank and I usually let them go to voicemail. So perfect. Especially now where we're coming up to a lot of things are going to be going on that parents need to know what's going on. I wish there was another way we can post what that Connect Ed message is, somehow post it for them.
It is posted. It's text. It should be. I'll talk to the principals, but every message that we send out from Central is also sent as a text message. So
Oh,
I'll make
nice.
sure
Okay.
I'll make sure the principals are doing that when they're sending out their message. It should, if they're doing a voice call, it should be followed up with a text. A text message should go out at the same time, just so they get it as a text as well. So I'll make sure. And then and I'll talk to Jess of actually her temporary replacement. I'll talk to about making sure that the messages should be posted on the website as well.
Yeah, no, that's perfect. If they're posted on the websites, that way, they can always go back and look if they missed something. So perfect. As always, thank you so much, Superintendent.
Mark,
right.
I'm sorry, it would be at 6:30, November 24th.
6:30. Okay,
Thank you.
very good. That's fine. Again, Melinda can get that coordinated with you. Okay, any other items for Superintendent Thomas?
Yeah, so I just want to follow up with congratulations to the school district and thanks to the school committee report, but the hard work that was done by Sharon Wolder and Karen Watts. And I believe Sharon worked with her team as her equity and diversity team with as we received the Nellie May, $250,000 of the Nellie May grant for equity and diversity and inclusion. This grant will allow us to continue the work that's been going on in the district. Obviously, this crucial work that's been going on around equity, diversity, and inclusion. This will allow us to open the Office of Equity and Diversity and hire a leader for that office within hopefully within the next 2 months, we'll be able to go through the process. We'll make it a process where the community school committees involved in hiring for this position, but we will advertise for it. We're in the process now of, developing, a job ad. I will be coming before the school committee. We'll talk about it in the in Cynthia's subcommittee meeting, and then we'll come forward to the school committee to get approval for that position. It is going to be funded by the Nellie Mae grant, but obviously the extra position would be obviously has to be approved by the school committee. So I just again want to thank Karen Watts for their hard work with their teams on getting this grant. It's a huge, it's just a great success that we ended up with this grant and be able to do the work we need to do going forward. And I'm thrilled about that. And thrilled about opening an Office of Equity, Diversity, and Inclusion, which is going to be great for the school system, but also for the city of Brockton as a whole. So I wanted to let you know about that. And then Sharon is with us, and I want her to just give you a quick update on the training, equity, diversity, inclusion training that we're having during this Monday on the 16th. We have a training coming up for the entire district, and Sharon will just give you a quick overview on that.
Good evening. As part of the Nellie Mae grant, part of what we wrote into the grant was an opportunity to do some diversity, equity, and inclusion trainings throughout the district beyond what can happen with the desk committee, because all of the members of the diversity committee that have been working for the past few years, they're all full-time teachers and a few administrators. And so most often we meet a couple times a month to put together the things that you've seen so far, especially with the equity checklist. That's coming from within the district, but to expedite the work and to provide more opportunities for people to engage in the work, the grant is allowing us to have the consultants that you met, Dr. Amina Pilgrim and Manuel Fernandez, to come in and do some work within the district. So on Monday, from 12:45 to 2:15, they will do a keynote for the entire district as part of our district-wide professional development. So Mike will introduce them, and then they'll take it from there and do a keynote for all of the educators in the district. And you're welcome to join us. We'll send you the information and the login information for that in your Friday packet. And in addition to that, the two of them will do 3 cohorts of trainings that are 8 sessions, 16 hours total, with the hope that they can train some trainers to go back into their schools and continue to be leaders of that work within their own schools. So that will be, in addition to the position that will be funded for this year, that will be some of the work. And the Diversity Education Steering Committee will continue to work with the Office of Teaching and Learning to develop lessons and increase the curriculum and resources that we have to support the work of equity, diversity, and inclusion in our district.
Excellent. Great. Well, thank you, Mrs. Wolder. This is exciting news for the district to be able to move a big priority that I know we have as a district forward. So this is a great thing. Any other comment on this topic, Mayor?
Mr. Vice Chairman, I want to thank Sharon and everybody and Cynthia's leadership and everybody on the subcommittee. I mean, this is a game changer, not just for the district, but for the city. So $250,000 is a lot of money, and we're going to spend every penny wisely on this. So kudos to everybody. Thank you for working in collaboration. And I also want to take a moment. We had 2 wonderful Brockton High alums last night participate in the USA pageant. Sabrina Victor, class of 2014, Brockton High, and Andrea Gabol, class of 2013, Brockton High. Both of them respectfully represented the City of Champions. They were boxer strong, and just great champions out of the city of Champions. I want to recognize both of those Brocktonians, as they really represented the city so well. And also today is the 245th anniversary of the Marine Corps and the legacy that's been passed down through the generations. And all of you know tomorrow's Veterans Day. And because of coronavirus, we can't do the annual parade. But all of you have been invited tomorrow as the city council and the state delegation and Congressman Lynch and U.S. senators. Tomorrow at 10 o'clock, brief ceremony that David Farrell, veterans agent for the city, will be doing at Legion Parkway at 10 o'clock. So again, if any of you on the call are veterans, we thank you for your service. And if any of your family members paid the ultimate sacrifice, we truly, truly thank any man or woman that served our nation. Thank you very much, Mr. Vice Chairman.
Thank you, Mayor. Yeah, it's a great point. We want to make sure that we take some time to remember our veterans, both those who we've lost and who are with us still, for the sacrifices that they made, so that we can enjoy the freedom that we have, because we absolutely owe it all to our veterans, no question. All right, is there any other business under other business? Does anybody have anything else? Are we good? All right. Then I had one comment I wanted to conclude with, and I say this a lot, but I don't think I can say it enough. So again, I want to thank all of you on this committee. I know we are putting in a lot more time these days than we ever have, where there's so many different new issues that have come up and come before us because of the pandemic that we've had to give a lot of different thought to, and think outside the box on how to deal with them. And so I want to make sure that I thank all of you for the great job you're doing and the hard work you're doing and the time you're putting in. Beyond that, I want to say to many of our Brockton Public Schools employees, and I hope the committee, I don't think you'll mind that I'm going to kind of speak on behalf of the committee here, but I definitely want to take a minute to thank our superintendent for his leadership and his administrative team for their work and their leadership as well. Our teachers, the mayor, all of the staff and in our schools, the janitors, our tech support people, our secretaries, and anyone else I'm leaving out, food service workers, all of everybody who is working in the district right now is doing jobs they never thought they would be doing, or they're doing their job in a way they never expected to be doing it. And it's all new. And really, we have all pulled together, and everybody has pulled together. And everything is about doing what's best for the kids. And as always, we always put the kids first, and we're continuing to do that. And but I just wanted to thank everybody. And I also want to mention and thank the parents and the students, because this is new and different for them and stressful for them. We've talked a lot about the way this is for kids, and also for parents who are trying to work and make sure their kids get an education. And these are tough times, and we're all facing new challenges we never anticipated. But as a city, we're stepping up to that challenge, and we're doing it together. And we will pull through this, and we'll come out on the other end stronger, and as we always are as a city, champions. So if there's nothing else, then item number 5 is executive session. So the school committee will go into executive session pursuant to MGL Chapter 30A, Section 21A3, to discuss strategy with respect to collective bargaining with the Brockton Education Association, known as the BEA, Brockton Education Paraprofessional Association, BEPA, Monitor Teachers Assistants, MTAs, Independent Brockton Administrative Assistants and Technical Employees Association, IBAA and TEA, Brockton Food Service Association, SEIU Local 888. As a reminder, the school committee will enter executive session pursuant to MGL 30A, Section 21A3, for the purpose of conducting strategy with respect to these collective bargaining units. As conducting these deliberations in open session would have a detrimental effect on the bargaining position of the committee will not return to open session following executive session. At this time, I need a motion to enter into executive session from a member of the committee.
Motion. Oh, it's okay, Ms. Rivas, you can have it. It's all yours.
Motion to enter into executive session.
All right.
Second.
All right, we have a motion to enter executive session, second by Mrs. Mendez, seconded by Ms. Asak. I will call the roll. Mayor Sullivan.
Yes.
Okay. Vice Chair D'Agostino, yes. Ms. Asak.
Yes.
Mrs. Mendez.
Yes.
Mr. Minicello.
Yes.
All right. Mr. Rodriguez.
Yes.
Mrs. Sullivan.
Yes.
Mr. Sullivan.
Yes.
Okay, we are in executive session.